With this, we move on to the last talk by Mohit Dogra, and that answers a very important questions. Sometimes you see CNV, especially in the era of OCT angio, and there is no fluid. And sometimes you see fluid, and Anirudh showed us that sometimes drusen can leak and there is a no membrane. So, what to do in either of these situations? Over to you, Mohit.
Thank you, ma'am, and thank you for the opportunity. So, as ma'am, beautifully set me up with this. So, basically, two different spectrums: membrane, no fluid; fluid, no membrane. What do you do, right? So, I'm going to start with the relatively easier to understand of the two, but at least to me. So, case one: a 75-year-old male had sudden painless decrease in vision in the right eye for 8 days. No complaints in the left eye at this point. Count fingers vision, you can see a pretty large submacular bleed. Also would have had, I think, a bleed in the past, which because it's altered and below the infratemporal arcade, doesn't take rocket science to know what that is. That there is artifact, and you'll soon see, why, because we have serial follow-up on that. So kindly ignore that. Had multiple drusens in this eye. That's the blown up of the same, and hence the artifact is also there. So multiple drusens, no hemorrhage, no fluid clinically. Patient was 612 parts, had had a very early immature senile cataract, and this is the best corrected vision. That is the OCT which is passing all through, and I said that's an artifact because that was pseudo color, but you can see that all the scans, you can see flat, irregular, fiped, sire, whatever you want to call it, but there is no evidence of any intraretinal, subretinal, or sub-RP fluid, and there is no evidence of any SHREM either. So for as far as current understanding and accepted treatment and kind of brackets of labeling patients are concerned, this patient is non-exudative. It's not exuding, right? So whatever we did for the right eye, I'm not going to concentrate on that. This is, talking about the left eye. That's a blown up of the same. You can see, just those arrows are just showing you the double layer sign and what that is and not. The retina was dry, both within, underneath, and below the RPE. And that's how the patient remained. The SSOCTA, however, showed that there were two complexes, which is one of that was there. I hope and the other one was almost like a semicircular, like a C-shaped, which was kind of conforming to the foveal avascular zone. So this patient had a membrane, no fluid, no symptoms. And mind you, this is a fellow eye which has had catastrophic vision loss secondary to wet AMD. So this is what the patient had. We chose to not do anything at that point in time. 3 months follow-up. Vision's not changed. The patient is not symptomatic. There is no fluid. I'm not showing the multiple OCT scans, so you'll just have to trust me on this. A 3 months follow-up. All the radial scans were same. No sub, intra, or sub-RP fluid. No SHREM. However, on the OCTA, you can see that butterfly kind of thing has actually become, the vessels are more denser, as are maybe the vessels in the which were in that kind of sea which was surrounding the foveal avascular zone. So now you have, so it's clear that this is a case of a non-exudative neovascular AMD. Fair enough. Patient's asymptomatic. We have 3 months follow-up. The patient's not saying anything, doesn't complain, but the membrane on octa has become denser. Is whether it's grown or not in size, no, but it's definitely more vessels there. So what do you do? Well, we chose to observe. We discussed with the patient, smart guy. Unfortunately, COVID hit all of us. He came a year and a half later. And smart, I'd actually trust him on this. He had no complaints till this point in time. Even at this visit, although he had lost one line, he was not complaining. At this point in time, I think it's a no-brainer. The PDs have grown. He has subretinal hyperreflective material. He has subretinal fluid. Advised anti-VEGF, but the patient somehow said, no, I'm okay. I just came because COVID was over. I was visiting Chandigarh, so main aa gaya ji aapko dikhane. So that's what he said. Of course, he comes a month later. I mean, we know once these membranes tend to start to exude and grow, that's what happened. Has now, almost all the telltale features of wet exudative AMD, has clinically detectable submacular hemorrhage, subretinal fluid, intraretinal fluid. You can see that membrane, those two separate ones have now bunched up together and formed the typical Medusa head kind of appearance there. Was managed, with monthly aflibercept injection. This is a recent follow-up, so 2, and has actually gone down to that. The caveat with this is that patients with wet AMD, and that's what you would with the current literature call them, with angiographically detected neovascular complex, either on FA, ICG, or OCTA. In this case, it was OCTA. But if there is no fluid, either subretinal, intra, or sub-RP fluid, and the patient has no symptoms, the current recommendation at this point in time is not to treat the visible membrane, to treat the visible fluid associated with the visible membrane. However, they need close follow-up with home ampoular monitoring or whatever else kind of monitoring that they can get, because what's been shown is that over 2 years, natural history of these is that they are 14 to 15 times more likely than patients without angiographically detectable membranes to start exuding over 2 years. But mind you, this is 2/3 of the patients. 1/3 of the patients will continue to be dry over the next 2 years, which is the longest history of the natural follow-up that we have on these. Hence, the recommendation is not to treat unless the membrane doesn't start exuding. So this is your neovascular non-exudative AMD. Now a little bit of a tougher, we're going to look at the complete opposite end of the spectrum. When there is fluid in the retina or under the retina, I'm going to be particularly talking about fluid under the retina, but no detectable membrane. So 63-year-old female, she presented with decreased vision in the left eye since 20 days. This is May 16. It's going to be a long follow-up. No complaints in the right eye, 6/12 parts. Left was 6/36. The right eye, as you can see, there is that sliver of low-lying subretinal fluid there. And she has these shallow, irregular pigment epithelial detachments or FIPED or whatever. Left is classic. Your, pathognomonic thing is you'd get PED, fluid at the top, fluid there. And these are just different scans passing through different areas. She also has SHREM. That's the, FAICG. The right eye FAICG shows nothing. The left eye shows a very subtle BVN, no polyps, and, I'd say a type, occult kind of staining on FA, diagnosed to have a type 1 MNV exudation, treated at that point in time with ranibizumab injections monthly into 3. The right eye, retrospectively, but was diagnosed to have fluid, subretinal fluid, no membrane detected on FA and ICG, so it was non-neovascular exudative AMD and was observed. So this is October 2016. After 3 injections, she unfortunately developed a rip in the left eye. As you can see, had fallen vision. The rip, again, unfortunately passed through the foveal center, and you can see the scarring, and that eye is ripped. The right eye, again, similar, has that shallow subretinal fluid pocket, has those shallow irregular detachments. Acuity is the same. 6 months later, March 17th, right eye is the same. Left eye we observed, offered no treatment. 1 year later, October 17th, right eye still that fluid, similar. Observation all throughout for the right eye, and after the unfortunate foveal rip, observation for the left eye as well. Acuity 1.5 meters, started to get in the left eye more fibrosed. Right eye, status quo. June 18, 9 months later, right eye 6/12 parts, patient has no visual complaints, similar fluid still, mind you, only in the subretinal fluid, not intraretinal. Left eye, is kind of remodeling after the insult to the ripped RPE, observed. Same thing. This is 1 year later, 2019. We started March 16. We are into 3.5-year follow-up. Right eye status quo, absolutely similar. Repeated the angio. Right, left eye, she started to get some activity in the periphery. We talked about this. She's like, I've not been seeing with that eye for some time. I do not want scotoma limitation. I'm okay with this eye not seeing even as good as it was. She chose to not get treated for the left eye, which was fair enough because the center was already scarred. Right eye, again, no intraretinal fluid, subretinal fluid there, draping over the PEDs. The PED height has gone up. The repeat FAICG at 3.5 years shows nothing. COVID hit us, 2.5 years follow-up, COVID-19 pandemic. Now she came recently, October 22, and she said she has gradual vision reduction, right eye, which is her only seeing eye, 3 to 4 months, had a cataract, 6/18 vision, could not do the ICG at that time, just could do the FA. The FA showed nothing, staining of the drusens, some subretinal fluid. There was, the PDs have gone up. You can also see that on the fundus photo. Left eye is just to show what happened to this eye after 2.5 years of patient not doing anything. The cataract had gone up considerably. You can see the fundus photo is not that clear anymore. Again, that was done. OCTA was done at that stage. OCTA was repeated again. Patient was observed. This is the last follow-up. Patient comes from Himachal, regular follow-up. This is May 2023. 6.5 years of following a patient which had subretinal fluid at presentation over shallow irregular PEDs. with no progression, no intraretinal fluid, no reduction in vision, no evidence of a membrane on FA, ICG, or OCTA, and this is what the patient had, and that's why we observed this patient. So I'm going to then come to the caveat of this, because I think that that'll be my time. So the caveat with this category of patients is where you have fluid, and I'm just talking about subretinal fluid, not subretinal with intraretinal. But there is no angiographically detectable neovascular membrane either on FA, ICG, or OCTA. The subretinal fluid can be present in any one of the three locations, the third of which is the case that I showed. You have your shallow irregular PEDs or your FIPED, and you have a sliver of like a drape of subretinal fluid. That the other can be presence of fluid over a large PED like that at the tip, almost like a cap, and at the edges where that PED joins the normal retina. So presence of fluid, subretinal fluid there over a large PED, or there or at the angles, or shallow irregular PEDs with a sliver of a subretinal fluid drape in the absence of any angiographically detectable membrane. These are non-neovascular. They could be drusonus or whatever. Maybe Dr. Aniruddha talked about that, as ma'am was saying. But the idea is not to inject at that time. But 60% of them, natural history over 5 years, will go on to, for that PED collapsing, and they will go on to develop a huge patch of geographic atrophy. So that needs to be told to the patient. That's the natural history. And unfortunately, as to the best of my knowledge, we don't have a drug available to modify that natural history in our current armamentarium. Thank you.
Thank you, Mohit. The message is very clear. Yes, I'll take up the question. And for the next team, we got Hall 25 minutes late, so bear with us for another 5 minutes.
Dr. Mohit, very good presentation.
Thank
so
you.
in your last case, where you showed large PED with a very shallow SRF,
Yeah.
if the patient is symptomatic, even then you will need to observe, or we should treat?
Anubhav, I'll show that case to you. I wanted to show it again, a long follow-up. I glossed over that. I'll discuss that. But so typically the patient was acutely symptomatic when the patient came again, 7-year follow-up, because the patient, she's an anesthetist. She is faculty with us at PGI. She's HLA-B27 positive, so she has had fundus examinations since a long time. So she did not have any PED. She suddenly got a PED, and she was symptomatic but with her refractive correction, she got 6.6 at that time. Did not have any fluid over the apex.
Okay.
None of the FA, ICG, OCTA didn't show a membrane in either of the eyes.
Okay.
Was followed up 7 years. Again, has had yearly FA, ICGs and OCTAs, hasn't shown a membrane. Fluids remain there, like that apex on top,
asking,
and
is
there.
symptomatic means
Yeah.
patient is 618 or 624 or 612 parts like that, not 66. If they come with recent drop in vision.
If I have documentation that the patient did not have that prior to so this patient, so I'll answer that with this patient.
We'll do this.
So 6.6 patient, we had follow-up of no PED, got a serious PED with some fluid on top, remained like that for 7 years. We did not treat. Most patients you'd see you will not have a prior follow-up knowing that the PED wasn't there. But we chose not to treat this patient even then, because this is not said to be a VEGF-driven process.
I agree.
There are other molecules at play.
I totally
The membrane
agree.
is not going to go there.
This in case I totally agree. Yeah.